I'm Benson Musumba, working with Nairobi Spine and Orthopedic Center as a physiotherapist specialized in musculoskeletal conditions, majorly orthopedic cases. There are various conditions that affect the foot. We have diabetic foot, we have plantar fasciitis, we have anunions, we have congenital foot deformity, and we have flat foot. Anunion is a bony protrusion or is a bony bump that forms at the base of the foot of the big toe. Causes like shoe, type of shoe you use, like the shoe that has no space, that is heel, the long heel shoe. When it comes to treatment, we do conservative treatment as physiotherapists, and part of the treatment is changing the shoe. We encourage that you get a shoe that has plenty of space that will prevent pressure on the toe. We also do padding. You cushion the space between the toe and the shoe. We also do medication, that is painkillers or anti-inflammatory drugs. We can also do icing. We apply ice, that is to relieve soreness or inflammation. And when the condition is severe, we refer the patient to an orthopedic surgeon, that is a foot and ankle and foot specialist. Another condition I'll talk about is diabetic foot. Diabetic foot is any condition resulting from pathology of peripheral arterial disease, that from the diabetes mellitus. Signs and symptoms for a person who has a diabetic foot might be swelling of the foot, changes in skin color, changes in temperature of the foot, pain in the leg. As a physiotherapist, we have no much on the foot rather than advice to the patient. And what we advise the patient is regular check of the foot to avoid missing out things like swelling, wounds on the foot, because somebody who has a diabetic foot has likely this sensory part of it is affected, and he might end up missing on the part things like swelling because the sensory is affected. And for us as a physiotherapist, we advise that you do what? You footwear to avoid pressure to the foot that can result in swelling. We also encourage, like we can use things like crutches for people who are severely affected to the foot. We teach how to use the crutch so as to avoid much pressure on the foot. Another condition I'll talk about is arthritis. Arthritis affect the ankle, affect the foot, majorly the ankle, and this may limit the functions of the foot. And treatment part of it as physiotherapists, what we do is re-education of the patient on the gait. We also advise on the weight of the patient. We do modalities like cryotherapy, that is icing. We also do yoga, that is hydrotherapy. Yeah, we can also do stretching of the muscles, that is gastrocnemius soleus muscles. We can also do tapping to activate the weak muscles. Another condition I'll talk about is heel pain. And the conditions that result to heel pain is plantar fasciitis and calcaneal spur. I'll talk about plantar fasciitis. There are various causes that lead to plantar fasciitis. That is tight muscles, discrepancy of the leg discrepancy, and we have flat foot. We have tightness of the muscles, can cause pain in the heel. For a flat foot, we advise that you use insole that has an arc. For more information, for more advice, you can visit us at Nairobi Spine and Orthopedic Center. We are located at 40 Suits along Hospital Road, opposite Nairobi Club. Thank you.